Nausea is a common and uncomfortable sensation that can be triggered by a variety of factors. While most people associate nausea with illness or digestive issues, it's important to know that certain vitamins and minerals can also play a significant role. In this video, we'll explore which nutrients are most commonly linked to nausea, why this happens, and how you can manage or prevent these symptoms. Whether you're taking supplements for health reasons or just curious about your body's reactions, understanding the connection between nutrients and nausea is essential for your well-being. Many people experience nausea after taking certain vitamins or minerals, especially on an empty stomach. This is because some nutrients are more irritating to the stomach lining or can be difficult to digest in high concentrations. The body's response can range from mild discomfort to more severe queasiness. Understanding why that happens helps you make better choices about when and how to take your supplements. Let's look at the most common culprits and what you can do to minimize the risk of nausea. Iron supplements are notorious for causing nausea, especially when taken without food. Iron is essential for making red blood cells, but it can be harsh on the digestive system. Many people report feeling queasy, experiencing stomach cramps, or even vomiting after taking iron pills. If you need to take iron, try doing so with a meal or snack to help buffer your stomach. There are also different forms of iron supplements, and some may be gentler than others, so consult your healthcare provider for the best option. Vitamin C is another nutrient that can lead to nausea, particularly when taken in large doses. This vitamin is acidic, and high amounts can irritate the stomach lining, leading to discomfort or even diarrhea. If you're taking vitamin C supplements, consider splitting your dose throughout the day or taking it with food to reduce the risk of nausea. Remember, most people can get enough vitamin C from a balanced diet rich in fruits and vegetables. Zinc is a mineral that supports immune function and wound healing, but it's also well known for causing nausea, especially if taken on an empty stomach. Many people describe a metallic taste or a queasy feeling soon after taking zinc supplements. To avoid this, always take zinc with food and avoid exceeding the recommended dose. If you're sensitive to zinc, talk to your doctor about alternative ways to meet your needs. Calcium is vital for bone health, but some people experience nausea or bloating after taking calcium supplements. This is more common with certain forms, such as calcium carbonate, which can be harder to digest. If you notice discomfort, try switching to a different type of calcium like calcium citrate or take smaller doses throughout the day. As always, getting calcium from food sources is often easier on the stomach. Magnesium is important for muscle and nerve function, but high doses can lead to nausea, diarrhea, or stomach cramps. Some forms of magnesium, like magnesium oxide, are more likely to cause digestive upset. If you're sensitive, consider magnesium glycinate or magnesium citrate, which tend to be gentler. Always start with a low dose and increase gradually if needed. Multivitamins combine several nutrients in one pill, which can sometimes overwhelm the stomach, especially if taken without food. The combination of iron, zinc, and other minerals is a common cause of queasiness. To minimize discomfort, always take multivitamins with a meal and avoid taking more than the recommended amount. If you continue to feel nauseous, consider switching to a different brand or formula. Fat-soluble vitamins like a D, E, and K can also cause nausea if taken in large amounts. These vitamins are stored in the body's fat tissues, so excess intake can build up and lead to toxicity. Symptoms may include nausea, headache, or dizziness. To avoid problems, stick to recommended doses and take these vitamins with a meal containing some fat for better absorption and less stomach irritation. B vitamins are essential for energy and metabolism, but some people find that high doses, especially of niacin B3, can cause nausea or flushing. Taking B vitamins with food can help reduce these effects. If you're sensitive, look for lower dose supplements or try getting your B vitamins from a varied diet instead. Folic acid, a type of B vitamin, is important for cell growth and pregnancy, but it can sometimes cause mild nausea, especially in higher doses. If you notice discomfort, try taking folic acid with a meal or splitting your dose. Most people tolerate it well, but if symptoms persist, consult your healthcare provider. Vitamin D is crucial for bone health and immune function, but taking too much can sometimes lead to nausea, vomiting, or loss of appetite. This is rare but more likely if you're taking high-dose supplements. Stick to recommended amounts and check with your doctor if you experience ongoing digestive issues. Vitamin A is essential for vision and immune health, but excessive intake can lead to toxicity, with nausea being one of the first symptoms. Other signs include headache, dizziness, and even liver problems. Always follow recommended guidelines and avoid taking multiple supplements that contain vitamin A. Vitamin E is an antioxidant, but taking too much can sometimes cause gastrointestinal symptoms like nausea or diarrhea. This is more likely with high-dose supplements rather than food sources. To minimize risk, stick to the recommended daily allowance and consult your doctor if you have concerns. Vitamin K is important for blood clotting, and while it's less likely to cause nausea than other fat-soluble vitamins, some people may experience mild stomach upset with supplements. If you notice discomfort, try taking vitamin K with food or discuss alternatives with your healthcare provider. Potassium is vital for heart and muscle function, but supplements can sometimes irritate the stomach lining, leading to nausea or even vomiting. This is especially true with large tablets or high doses. To reduce risk, take potassium with plenty of water and food and never exceed your doctor's recommendations. Selenium is a trace mineral needed in small amounts, but taking too much can cause nausea, along with other symptoms like hair loss or fatigue. Stick to the recommended daily intake and avoid combining multiple supplements that contain selenium to prevent accidental overdose. Copper is essential for making red blood cells, but high doses from supplements can cause stomach upset, including nausea. This is rare but possible if you're taking multiple supplements or high-potency formulas. Always check your supplement labels and talk to your doctor if you're unsure about your intake. Chromium is sometimes used to support blood sugar control, but some people report mild nausea with supplements. This is usually dose-dependent and can often be avoided by taking chromium with food. If you experience ongoing symptoms, consider lowering your dose or discontinuing use. Iodine is crucial for thyroid health, but supplements can sometimes cause stomach irritation and nausea, especially in high doses. If you're taking iodine, make sure to follow your doctor's advice and avoid unnecessary supplementation unless prescribed. Manganese is needed in trace amounts, but excessive intake from supplements can lead to nausea and other digestive issues. Most people get enough manganese from their diet, so supplementation is rarely needed unless recommended by a healthcare professional. Phosphorus is important for bone and energy health, but high doses from supplements can sometimes cause digestive discomfort, including nausea. This is uncommon but can happen if you're taking multiple supplements or have kidney issues. Always follow dosage recommendations and consult your doctor if you have concerns. Fluoride is often found in dental products, but some supplements contain it as well. Ingesting too much fluoride can cause nausea, especially in children. Always use supplements and dental products as directed and keep them out of reach of young children to prevent accidental ingestion. Vitamin overdose, also known as hypervitaminosis, occurs when you consume more vitamins than your body needs, often from supplements. This can lead to a range of symptoms, with nausea being one of the earliest signs. It's important to understand that more isn't always better when it comes to vitamins. Stick to recommended daily allowances and consult a healthcare professional before starting new supplements. Mineral toxicity happens when you take in too much of a particular mineral, usually from supplements rather than food. This can overwhelm the body's ability to process the mineral, leading to symptoms like nausea, vomiting, and even organ damage in severe cases. Always be cautious with mineral supplements and avoid taking more than the recommended dose unless advised by a healthcare provider. Taking vitamins and minerals on an empty stomach is a common cause of nausea. The stomach lining is more sensitive without food, making it easier for certain nutrients to cause irritation. To reduce the risk, always take your supplements with a meal or snack unless otherwise directed by your doctor. High doses of vitamins and minerals are more likely to cause nausea and other digestive issues. Your body can only absorb so much at once, and excess amounts can irritate the stomach or overwhelm your system. Stick to recommended dosages and avoid megadoses unless prescribed by a healthcare professional. Type and formulation of a supplement can affect how likely it is to cause nausea. For example, some forms of iron or magnesium are gentler on the stomach than others. Chewable or liquid supplements may also be easier to tolerate. If you're experiencing nausea, talk to your pharmacist or doctor about alternative formulations. When you take your vitamins and minerals can influence how your body reacts. Spacing out your supplements throughout the day rather than taking them all at once can help reduce the risk of nausea. This gives your digestive system time to process each nutrient more comfortably. Staying hydrated is important when taking supplements. Drinking plenty of water can help your body process vitamins and minerals more efficiently and reduce the risk of stomach upset. If you're taking large tablets, water also helps them move smoothly through your digestive tract. Getting your vitamins and minerals from food is generally less likely to cause nausea compared to supplements. Whole foods provide nutrients in balanced amounts and are easier for your body to process. If you're experiencing nausea from supplements, try to meet your needs through a varied and balanced diet whenever possible. Sometimes, nausea from supplements isn't caused by the vitamin or mineral itself, but by other ingredients like fillers, dyes, or allergens. If you have known sensitivities, check supplement labels carefully and choose hypoallergenic or simple formulas to minimize risk. Pregnant individuals are often prescribed prenatal vitamins, which can be high in iron and other nutrients that may cause nausea. If you're pregnant and struggling with supplement-related nausea, talk to your healthcare provider about alternative formulations or timing strategies to help manage symptoms. Children are more sensitive to high doses of vitamins and minerals, and accidental ingestion can quickly lead to nausea or more serious symptoms. Always keep supplements out of reach of children and use child-specific formulas as directed by a pediatrician. Older adults may experience changes in digestion that make them more susceptible to nausea from supplements. Slower digestion and increased sensitivity mean it's especially important to take supplements with food and to use lower doses when possible. Some medications can interact with vitamins and minerals, increasing the risk of nausea or other side effects. Always inform your doctor or pharmacist about all supplements and medications you're taking to avoid potential problems. Certain health conditions, such as gastrointestinal disorders, can make you more prone to nausea from supplements. If you have a sensitive stomach or a chronic condition, work with your healthcare provider to find the best supplement strategy for you. It's important to recognize the early signs of nausea or digestive upset when starting a new supplement. Symptoms like queasiness, stomach cramps, or loss of appetite can be your body's way of signaling that something isn't right. Pay attention to these cues and adjust your supplement routine as needed. If you experience persistent or severe nausea after taking vitamins or minerals, it's important to seek medical advice. Ongoing symptoms could indicate an underlying issue or a reaction to a specific supplement. Your healthcare provider can help determine the cause and recommend safer alternatives. To minimize the risk of nausea, always follow safe supplement practices. Take vitamins and minerals with food, stick to recommended doses, and avoid combining multiple products with the same nutrients. Read labels carefully and consult your doctor if you have any questions. Not all supplements are created equal. Look for reputable brands that use high-quality ingredients and have third-party testing. If you're prone to nausea, opt for gentle formulations and avoid unnecessary additives. Your pharmacist can help you choose the best option for your needs. Keeping a symptom diary can help you identify which supplements may be causing nausea. Note when you take each supplement, what you eat, and any symptoms you experience. This information can be valuable for your healthcare provider in finding the right solution. If you notice nausea after starting a new supplement, try adjusting your routine. This might mean changing the time of day you take it, splitting the dose, or switching to a different form. Small changes can make a big difference in how your body responds. Several vitamins and minerals are linked to nausea, especially when taken in high doses or on an empty stomach. Iron, zinc, vitamin C, and multivitamins are among the most common culprits. Always take supplements with food, stick to recommended doses, and consult your healthcare provider if you have ongoing symptoms. Being informed and cautious can help you get the benefits of supplements without the unwanted side effects. Understanding which vitamins and minerals are most likely to cause nausea empowers you to make better choices for your health. Remember, supplements can be helpful, but they're not always necessary for everyone. Focus on a balanced diet, use supplements wisely, and always listen to your body's signals. If you ever have concerns, your healthcare provider is your best resource for personalized advice.